Alrighty, good morning. We're talking about microdermabrasion today. The exciting thing about this procedure is that it's the procedure I give credit for catapulting the esthetician. As much as we talked about glycolic acid made a facial a scientific treatment, microdermabrasion made the esthetician a household name. Without this procedure, believe it or not, we would still be washing faces in a salon. There would be no clinical, there would be no medical aesthetics, there would be no Tino. All right? So it is this procedure and this procedure alone that created a huge hype in skincare, a massive media frenzy in skincare, and because of the money that it created, also grabbed the medical community to be interested in this field. So we can talk all day about, medical versus aesthetic and, who should be doing it and who should not be doing it, but nonetheless we can agree that this procedure is the one that got all the attention. And to me, at least, I hear esthetician at least a couple of times in any newscast now. Right? People know what an esthetician now is versus, years ago. So this procedure and this procedure alone made us our money and gave us our reputation for other things to come into play. All right? Microdermabrasion, also known as MDA. What is it? Other names for microdermabrasion might be called particle skin resurfacing. You were resurfacing the skin with particulate, with particle, right? Sand, crystal, whatever it might be. Everyone has their own version of a crystal, but we'll talk about why aluminum oxide is the best one. Dry exfoliation might be another name for microdermabrasion. Mechanical exfoliation, epidermal particle skin resurfacing, you name it. There's all sorts of names given to microdermabrasion, but please do not ever call this procedure dermabrasion. You will make me get goosebumps every time I hear that, all right? I'll explain to you what dermabrasion is in a second, all right? Microdermabrasion. Oh. What is microdermabrasion? It is a mechanical exfoliation is what it is. I wanted to make sure that you know the difference between a mechanical resurfacing procedure and that of a chemical resurfacing procedure. They both resurface the skin. And can one replace the other? Absolutely. Can one be more effective than the other? Absolutely. Is there a reason to combine them? Yes. But do know that microdermabrasion is a mechanical exfoliation. And what is mechanical exfoliation? If we actually define it, we're looking at any grainy substance that when combined with friction exfoliates parts or all of the stratum corneum. And the reason I had to add that is because we have to put microdermabrasion within the division it belongs of mechanical versus chemical exfoliation, but also to make you understand and for you to educate your patients or clients on what microdermabrasion is not. All right, because there's brush machines out there who say they're microdermabrasion. All right, now when you really get down to dissecting the words micro and then dermabrasion, micro being very small, then those machines are more of a microepidermabrasion. Does that make sense? And even all the procedures we do are really microepidermabrasion. Does that make sense? And so even the word dermabrasion tends to be, within the microdermabrasion word, tends to be a slightly bit misleading. Okay? Chemical resurfacing exfoliation can be done with pumice, nutshells. Everyone's used that apricot facial scrub. And you think I don't know that you haven't used it? All I'd had to do was go to the ITS school, and see some people when you know someone's using a buff puff or a pumice or a pecan and apricot facial scrub too much, or when they're using it as a cleanser. You can tell because the color between the zygomatic and then the lower part or the middle part right above mandible is lighter than any part of their skin. There's a whiteness to it and an irritation to it. Often people will use a scrub as their cleanser, and it's not necessarily a smart idea. Because if they're using things like pumice or nutshell or walnut or pecan, it can be quite abrasive, which is not bad if you're doing it once or twice a week. You can see how that could be quite irritating if it is every day. Now, if your skin is, I hate this word, clogged, the skin has a lot of retention, hyperkeratosis, then maybe daily exfoliation might be a good thing, but then I might choose to do a jojoba bead instead. You showed me you're proactive, and you said it was sort of grainy. Well, proactive needs to make a non-grainy version of benzoyl peroxide. Does that make sense? Because you can see how in a Fitzpatrick 1, 1.5, 2, that might be too much. Does that make sense? Microdermabrasion is a mechanical form of exfoliation, all right? And microdermabrasion is a professional treatment that is done in an office, salon, med-spa, or medical setting. It is not something done at home with a $100 to $250 unit. Yes, Gil?
Somebody had mentioned to me that aluminum oxide destroys bacteria. Is that true then? It doesn't sound like it's true the way you're talking.
I've never heard of aluminum oxide being an antibacterial. Never. It's inert.
Okay.
So, but the only thing that I have learned, and I can say that from my experience, is that, like I said, it has a drying effect on the skin, which helps acne and oily skin. Who's going to like microdermabrasion the most? That oily skin person. That grade 1 and grade 2 acne. Right?
Okay.
Or people who need the mechanical effect. Am I hurting? Am I feeling something? Right? Okay. You know, started on silicone. All right? So, nylon brushes are the best. All right? Chemical resurfacing exfoliation, you've done some. You've done some AHA, some vitamin C, some honey AHA, some 70%, some salicylics or Gessner's. And, of course, pumpkin enzymes, which are not new. They've been around a long time. I was using them in '96. It's just that pumpkin is a natural source, and some people like that. And pumpkin is also just one of my favorite things to use, especially now they're combining it with acid and making them stronger. But, yeah, we'll use some pumpkin today. But that's a chemical type resurfacing, right? Where technically these are chemical resurfacing or exfoliations. These are enzyme exfoliations because an enzyme is not necessarily a chemical. It's more of a creating the reaction. Does that make sense? So even an enzyme can have its own subsection as an enzymatic resurfacing or enzymatic exfoliation. All right?
Pumpkin peels do other pumpkin peels have, like the one that I have, has 30% glycolic acid?
No, they don't. And so there are people who are sensitive to the glycolic content, and they will do just fine with just a pumpkin peel. Does that make sense?
Yeah.
So to me, I think a good esthetician will have a couple of different pumpkin peels. Asians and African Americans especially are at risk for post-inflammatory hyperpigmentation, not only with acids, but definitely with mechanical exfoliation. More aggressively with mechanical exfoliation, you're less likely to hyperpigment and black or Asian skin with a lactic or a pumpkin, right, than you are with an aggressive microdermabrasion. Asians have a big history of scarring with mechanical exfoliation. So that's, again, one of those things that be careful with Asians and mechanical exfoliation. I might choose to do an enzyme or a proteolytic enzyme like a papaya or a bromelain or a pancreatic herbal enzyme on them until I know how their skin's going to react. It's not microdermabrasion. Finally, black people, before lactic started to be used the last couple of years, black people and Asian